So I'm gonna be talking about the knee eval that I realized yesterday for a patient from wrestling. He's like I said, he's a wrestling player. On a little bit of background that he told me about the knee was his right knee on the lateral side. He's having pain. He told me that he felt a pause during practice. He kept going on practice with the pain. He said that it hurts on the outside part of the knee. He didn't have any injuries before on the knee or anything. I realized the palpations. I rule out every area of palpation available on the knee. So I'll palpate the front side, I palpate the lateral side, the medial side, and also the posterior side, just to try to rule out, see if it's not something from another area that is compensating on the lateral side and everything. He only had a slight tenderness on the lateral side and on the rectus, on the biceps femoris muscle, on the tendons. He had a slight tightness over there, and also like on the IT bands too. I evaluate his range of motion. It was 5 out of 5 on both of them. I realized on facial tests, I started doing the same thing as palpation. I started to roll out everything, anterior side, posterior side. I realized anterior drawer. I realized Lackman's. I realized posterior. I also realized the Corvins, which is, yeah, the Corvins. I also realized McMurray's, and lastly, I did varus and valgus. I did varus and valgus tests, which he had a positive on varus, with a slight laxity, slight movement to the lateral side. So the diagnosis that we came up was with a slight strain on the LCL side. The progress that we told him, since it happened a couple of days ago, we wanted to like lower the swelling that he had at the moment. Actually, by seeing it, he didn't have any type of swelling or anything. So now that I remember well, so we try to go right away with some exercises. We did some like squats to strengthen the area, some lateral lunges and everything, and also I came up with the idea to do some like single leg stabilization, just trying to hold there, so that we can be able to strengthen the area there. The way that I feel for that, I feel really comfortable doing the tests and everything, because before going through this type of information on class, I've been having a couple patients with some knee problems, since my preceptor takes care of wrestling. So in wrestling, there's a couple patient that has like some knee problems and everything. So I've been getting very familiar with it before the classes. So like when it comes to the class, I was able to understand more the general side, not more in depth. So like I was able to clarify and understand more in depth the information that it was needed and everything. Since my preceptor was just like explaining me only like the general side that it was happening at the moment and all that stuff. Some areas that I can be able to improve will be more of special tests. I feel like I can be able to do properly, but it takes me some time on it, like trying to be able to do the hand placement properly. For example, when it comes for Lachman's, usually the palpation for the thumb will be in the tibial tuberosity, and sometimes I can be able to get like a proper grip below the leg or anything, so I can try to like move it upwards and see if there's some laxity or anything like that. So that will be like my major problem in the area that I will need more improvement. It will be some of the special tests.